The COVID-19 pandemic is affecting not just physical health, but also emotional and social health. During Singapore's circuit breaker period, older adults felt socially isolated and less satisfied with their lives. That was one of the findings of a Singapore Management University survey of 7,500 people aged 55 to 75. Now, as the circuit breaker began in May, all three areas of well-being started to fall as respondents were less satisfied with overall life and with their social life and economic situation. For those living with others, their satisfaction levels fell to pre-circuit breaker levels of peers living alone. Satisfaction was even lower for those living alone, as safe distancing measures made it tough for them to interact with friends or family. As the economy takes a hit from the pandemic, older Singaporeans who lost income also reported lower life satisfaction. While satisfaction levels began to recover in June, they remained below pre-COVID-19 levels. A digital divide also affected the well-being of older citizens. Compared to those who only used phones, others who engaged in various types of communication, such as video calls and social media, felt less isolated. Meanwhile, recipients of government support in addition to the Solidarity Fund reported higher levels of satisfaction during and after the circuit breaker. These latest findings are from a monthly survey carried out by SMU's Centre for Research on Successful Aging. They come on the back of a new $15 million donation over 7 years by the Ngee Ann Kong Si to the centre. Through partnerships with government agencies and non-profit organizations, the centre aims to turn research findings into policy innovations.
Whenever there is new initiatives, we can immediately then poll our respondents to get their feedback and therefore deconstruct the efficacy, right, of the new initiatives. And of course, whenever there are disruptions or unexpected circumstance, we can immediately get responses